Continuations of factors that contribute to health, 3805, Session 6E. There's theories about our moral development. We discussed how that process takes place. Let's look at some of the theories for moral reasoning by Kohlberg. He says we have 6 stages that are most widely accepted. This is the cognitive development process, so sequential in nature. We learn our rules, we learn rules that are imposed by authority, and we understand that obedience and punishment are opposite. Conformity to expected social and religious mores are there, and then autonomous thinkers strive for a moral code beyond the issues of authority and reverence. So there are essential values for the professional nurse. 1, there's altruism that we really should consider, and I think most of us are that way. There's equality. We want it for everyone. There should be justice and health care for everyone. At the aesthetics, we should do it the best that we know how, and we should also make sure that the patient feels its best. There should be freedom of patients to choose. There have human dignity, respect of all, regardless of their choice, and justice and fight for that justice for them, and always be able to share with them the truth. So look at some of these ethical theories that drive our practice. 1 is normative. It's a branch of ethics that's concerned with determining whether an action is right or wrong. Normative ethics attempt to develop a set of rules or norms that govern human conduct. It deals with what people should believe to be right and wrong, instead of like descriptive ethics, which deals with what people actually believe is right and wrong. When most people use the terms morality or ethics, they almost always are referring to normative ethics, for it is this branch that is concerned with telling us how we should live our lives. Let's look at some of the framework that are in that normative ethics. 1 is utilitarianism, which is that we have the greatest good for the most people. Assumes that an action is right if it leads to the greatest balance of good consequences, or the fewest bad consequences. Deontology is the decision is right if it conforms to an overriding moral duty and wrong if it violates that moral duty. So you say, what's the purpose of these ethical principles? Because they establish good common ground between the nurse, patient, family, and other healthcare professionals, and society to discuss ethical questions to make ethical decisions. It permits people to take a consistent position on specific or related issues and provides an analytical framework by which moral problems can be evaluated. So let's look at this one. Autonomy. It's a principle of respect for the person, unconditional intrinsic value for all. People are free to judge their judgments as long as they do not infringe on others. Concepts of freedom and informed consent are grounded in this principle. Beneficence. We want to promote goodness, kindness, and charity. We want to abstain from injuring others and to help others further their well-being by removing them from harm. The common bioethical conflict results from an imbalance between the demand of beneficence and those of the healthcare delivery system. Non-malfeasance implies a duty to inflict no harm, to abstain from injuring others, or judging others for that matter, to help others further their own well-being by removing harm. And veracity. We must tell the truth. It's a principle of telling the truth. Consumers expect accurate and precise information from us. For trust to develop between the provider and patient, there must be truthful communication at all times. It's a challenge for us, however, to mesh the needs for the truthfulness communication with the needs to protect. And then the ethical decision model making, where you have a situation assessment procedure, where you identify the ethical issues and their problems, you identify and analyze available alternatives, you select one, and then you justify the alternative. This is the model for making your ethical decisions. So you find out what's the issue, what are the hidden issues, what are the complexities of the situation, and are you overlooking anything? You want to find out what's reasonable possibilities for action? How should the different parties want to resolve the problem? And what are the ethical principles that are required if there is an alternative?